Welcome to Healthy Cleveland. I'm your host, Leah Longbrake. Today's topic is on measles. With us is Dr. Natalie Hinchcliffe, the medical director with the Cleveland Department of Public Health, and Jordan Bryan is our American Sign Language interpreter with the Cleveland Hearing and Speech Center. Welcome.
Thank you. Thanks for having me back.
Let's start off with the basics. What exactly are measles?
So measles is a highly contagious illness, and we often think about it as a fever and a rash, but there's a bit more to it than that, and it's infective really before you even see someone with a rash. You're going to notice people who have measles have a high fever, they have red eyes, runny nose, and a cough, and that can sound like anything, right? After you see those symptoms is when people present with the rash, but they're infective way before the rash and after, 5 days before and 4 days after. So we really think about measles as a highly contagious vaccine preventable illness.
So I read somewhere that measles had been eradicated basically 20 years ago. They declared it over and done with. We don't have it anymore, but it suddenly has made a comeback. Why is that, and what are the number of cases we're looking at both locally and globally?
So you're absolutely right. The Center for Disease Control, the CDC, declared measles eliminated in 2000. And that was here in the United States, but of course measles is still present throughout the world. In the Americas, Africa, Middle East, Asia, and parts of Europe, we still see measles again among people, predominantly people who are unvaccinated. And with international travel, unvaccinated people and people without immunity are always going to be at risk. In 2019 alone, from January 1st until August 15th of this year, we've seen over 1,200 cases of measles here in the United States. It's in 30 states throughout the United States already this year in 2019. And we have had a case of measles right here in Ohio as of July.
And so I read that you don't actually have to physically touch the person that has measles.
Yes, yeah.
Explain that more. Like, how exactly do you contact measles then?
So you can contact measles just by being in the same public space as someone else. You don't have to have physical contact of touching, kissing, hugging, anything like that. You can get it from droplets in the air. So someone near you who coughs and has measles, and like we said, that cough is going to be way before there's a rash. So that person may just look like someone who has a common cold, and you wouldn't know because you wouldn't see the rash that would make you think of measles.
So you mentioned the runny nose and rash. What are additional symptoms to look out for?
That's the thing. It doesn't look tremendously different from other illnesses like the flu or a common cold. The main things that you see are that high fever, red eyes, runny nose, cough, 5 days later a rash, and for up to 4 days after the rash is gone, that person is still infective. They can still give, or infectious, they can still give measles to other people.
Oh my. So who's most at risk?
That's a great question, and it's true with almost all vaccine preventable illnesses. The very young, the very old, those who may be immunocompromised, whether that's because they are living with HIV or AIDS, whether they have cancer and are on immunotherapeutic agents or immune modulating agents even, patients who are on certain medications like those who have medicine for rheumatoid arthritis, anyone whose immune system is pushed down. Of course, pregnant people are especially at risk, and young children, as we mentioned, very old and very young, but young children are at the greatest risk of the complications that can come even after measles. After you've recovered from measles, you can still, weeks to years later, have significant illness that can be fatal or remarkably disabling.
That's what I was going to ask next. Is it treatable, and is it fatal?
Yes, so the most important thing to think about with measles is that it's preventable. The pieces that come after the illness, those are pieces that the person has already recovered. So when we're talking about the time that someone is infected with measles, they've had the rash, they've gotten better, the main thing we think about that we're concerned about is measles encephalitis. And you may have seen a case in the news recently about a flight attendant on a flight from Israel to New York, or the other way, I'm not sure, that themselves was infected with measles, and they died of measles encephalitis, and that was just this month in 2019. We also know that weeks after the illness, you can develop something that also infects your brain, and that illness has a high percentage of fatality. It's called sclerosing disseminated encephalomyelitis, or SDEM. And with that illness, you can see 10 to 20% of people will die, and 1 in 4 will have significant disability and neurologic illness. Comparing that, though, with measles encephalitis, 1 in 10 of those people will die. And again, thinking that once you've recovered from measles, you're not out of the woods.
Right.
So years and years later, you can have a sclerosing illness that is 100% fatal and is most at risk in developing in children who were sick. The younger the child is when they were infected with measles, the more likely they are to have these illnesses down the road.
Just like how anything spreads with children in schools, you're in that space, so it can easily spread if the child's not vaccinated.
Absolutely. And like we said, they don't even have to have contact with the person who's infected. But of course, in a daycare setting or a school setting, they're all touching each other.
Right.
And I mean, that's a wonderful, lovely part of child development. But when we think about children in that classroom or in that daycare that might not themselves be vaccinated, we really are talking about a public health concern where everyone in that room is at risk.
It's become an epidemic.
Absolutely.
So we have much more to talk about with measles, including how to prevent it, but we're going to take a quick break. So don't change that channel. We'll be right back with more Healthy Cleveland. Welcome back to Healthy Cleveland. I'm your host, Leah Longbrake. Today we're discussing measles. With us is Dr. Natalie Hinchcliffe, who is the medical director with the Cleveland Department of Public Health, and Jordan Bryan, who is our American Sign Language interpreter with the Cleveland Hearing and Speech Center. Welcome back.
Thanks.
So we talked about how you develop measles, how you get measles, but prevention,
Yes.
which is always the important first step. So how can we prevent getting measles?
Vaccinate, 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 vaccinate. I cannot stress this enough. Measles is a vaccine preventable illness that can be fatal. It can cause blindness, it can cause heart disease, it can cause death, it can cause significant neurologic illness, seizures, disability, and we can prevent it with vaccines. Certainly, we don't want to push vaccination on people who have religious beliefs that make it not right for them to receive that vaccination, but vaccines are safe and they prevent significant illness. We recommend vaccination starting at 12 months old, but there is a caveat to that. Any child before they reach 12 months who's going to travel, we recommend that they receive at least 1 dose of the measles vaccine, the MMR vaccine. And for those people, they would get that first dose between 6 and 11 months and then continue on the traditional trend, which is 2 doses, the first between 12 and 15 months and the second between 4 and 6 years. But if parents are particularly concerned because they live in a high-risk area or if individuals are at particular risk, those 2 vaccines can be made a lot closer and they can be they can be as close as 28 days apart. And the vaccine works. The first one is 93% effective at preventing measles, and the 2 together are 97%.
So what about adults? Like, I was vaccinated as a child, but do I need to get an adult booster? Because there's certain vaccinations you need to get later on in life.
We don't believe that adults need to get boosters or have their immune status checked, which would be a blood test, but there are certain people who should have their immune status checked. When I spoke before, I was talking about people who may be on certain agents that lower their immune system, potentially chemotherapy or immune modulating agents, or even people whose illness themselves, like cancer, HIV, or AIDS, reduces their ability to fight off infection. Those would be people that we would want to check their blood to make sure that the vaccination worked for them. And people who are remarkably immune suppressed, they may be the people that the vaccine has run out or no longer is effective because they don't have enough immune cells to respond.
And the measles shot is lifetime, correct?
Yes. Yes, you do not expect to need a booster or to have it rechecked. It's only in special circumstances where people are at an immune suppressed state where we would want to check in their blood to make sure the vaccine that they got worked.
It's one of the few vaccines that is a lifetime vaccine.
Absolutely.
So you mentioned there are people that have religious beliefs that don't want to take the vaccine. But what do you say to people that, there's the whole hot topic about it causing things like autism. So how do you deal with a parent or someone that doesn't want to vaccinate their child because of something they've heard on TV or magazines?
Right. So I think the most important thing is to provide them with accurate evidence-based information and do it in a respectful manner. Many of these parents or caretakers are doing what they think is right. They're trying to act in the best interest of their child, and they probably have received inaccurate medical information, and it's my job as their physician or clinician to correct that information and do it in a respectful way so that they can hear me. Measles vaccine cannot cause measles. Measles can be fatal. Those are two key pieces. But also I think that people are having misinformation, like the autism piece, which has been debunked multiple times. The physician that initially wrote this letter had to retract their study. It is not something that we have any doubt whatsoever about in the medical community. And we have decades of vaccines, and we would absolutely know with the massive number of people who have been vaccinated if it caused something as significant as autism. And of course we know in medicine and in life that because two things are associated doesn't mean that one caused the other. But certainly personal stories make a really big difference. So if someone has another parent that they know at the school that they go to and their child was vaccinated and then developed autism, that's going to be a really personal story for them. It's going to be really hard for them to challenge that because they know that person, they've seen the effects of that. So one of the things that I would share when we're talking specifically about measles with that person is about the fact that we've had measles right here in Ohio. We talked before about having the first case in 2019, this July, but we had an outbreak in 2014 in Ohio. 138 people in this state were infected, and it was among a group of people who did not vaccinate. Pure and simple. Even thinking about the case of measles that we had here in Ohio in July and talking as we did about how we'll always be at risk in the United States, whether it's because people are unvaccinated or because they're coming from places where they cannot receive the vaccine or it's not available, thinking about international travel. That person in July hadn't traveled internationally. They had traveled within the United States and went to a place that in the United States had measles from somewhere outside the United States, and then they brought it back to Ohio.
So the trend of not vaccinating is why measles has come back.
1,000%, and I think that's really important to clarify. We are seeing a rise in not only measles, but many vaccine-preventable illnesses and associated deaths because of people not vaccinating.
As I saw a report where polio was back, and that's been gone since, what, the 50s, 60s?
Yes. And many of these illnesses, we have promoted vaccination so significantly because decades ago we saw what happened. We saw the iron lungs, we saw people die, but we're at a point where we're generations past that. And so people don't have that personal experience to know this is what it looks like when you don't vaccinate. These are the outcomes. But they do have personal experience with some things that are also concerning, like the potential development of autism. And so you really have to provide information that gets to people's heart and their core and that is based on science and fact.
Where can our viewers go to get vaccinated?
That's a great question. So, of course, the Cleveland Department of Public Health, the two clinics, one McCafferty that we have on Lorraine and also J. Glenn Smith on St. Clair on the east side, we have vaccines for children if they are uninsured, underinsured, or have Medicaid at no cost to them.
Oh, wonderful.
And of course, anyone can check in with their primary care clinician and speak to them about their own immune status, looking at their own immune record, a record of immunization, and also if they're in one of those groups where it's possible that they've been immune suppressed and that vaccine might not be working anymore, they can have a blood test to ensure that they have antibodies, their body's ability to fight off measles.
So if an adult wasn't vaccinated as a child, it's not too late?
It's not too late. It is not too late.
Anything
Adults
else?
Can be vaccinated.
Absolutely. Anything else you think viewers should know about measles and immunizations?
I think the most important thing to know is that we know that these vaccines are safe, and even more significantly, that if we look through history, we know the fatality and the significant disability that can happen from these illnesses. And I would encourage people to look as best and as comfortably as they can at science and at facts, and try to tease that out from the emotional relationship that we all have when we see or hear something that touches us personally. Because now we're at a point where measles is touching us personally. Yeah. It's here in Ohio in our own backyard.
Yes. How can we get more information?
So, of course, your Cleveland Department of Public Health will provide you with great information. Of course, also the Cleveland Department of Public Health website, and speaking directly to your clinician.
Wonderful. Well, thank you so much, Doctor, for being here today. I know our viewers have learned a lot, as have I.
Great. Thank you so much for having me. I appreciate it.
And thank you so much for tuning in to Healthy Cleveland. You can get all this information at tv20cleveland.com. I'm Leah Longbrake. Until next time.